Welcome to KidsMatter Early Childhood and our online community of professional development and collaborative learning. KidsMatter Early Childhood is a national mental health promotion, prevention and early intervention initiative that strengthens educators' skills, knowledge and confidence to support children's mental health and well-being. KidsMatter Early Childhood has three key aims: improve the mental health and well-being of children from birth to school age, reduce mental health difficulties among children, and achieve greater support for children experiencing mental health difficulties and their families. As a universal mental health initiative, KidsMatter has a focus on promotion, prevention and early intervention. This means that all children and their families are included, not just those at risk. The Getting Started video series provides you with a variety of ideas and suggestions that will help you to consider what you need to make a start and successfully implement KidsMatter, how to make real changes in your practice and keep the momentum going. Early childhood mental health is seen in the capacity of a young child within the context of their development, family, environment and culture to participate in the physical and social environment, form healthy and secure relationships, experience, regulate, understand and express emotions, understand and regulate their behaviour, interact appropriately with others, including peers, and develop a secure sense of self.
Well, early childhood mental health for me always means children who have a range of good emotional abilities, social abilities that allows them to relate well to others and to express their needs, their desires. It is about their ability to communicate about problems, to address conflicts. It's about being able to be assertive, to be able to express joy and happiness, to be able to enjoy the fullness of the experiences they have in their lives.
Mental health and well-being is now a #1 health challenge for Australians, and more than 50% of adults are likely to experience a mental health problem. The foundations for lifelong mental health and well-being are laid down in the early years. The first 1,000 days are particularly important, and even small actions can make a big difference at this stage. Many mental health difficulties can be identified in the early years, and there are benefits in intervening early before problems become entrenched. Early childhood settings are ideal places to promote mental health as they involve frequent and ongoing relationships between children, families and staff. There are 6 guiding principles that underpin and explain the beliefs and assumptions of the KidsMatter Early Childhood framework. These principles assist you to focus on the importance of mental health and orientate you throughout the implementation process. The KidsMatter framework is also based on the Bronfenbrenner social ecological model. This model recognises that there are many different influences on children's mental health and well-being. The child is at the centre and their development and learning occurs within the context of relationships with family, early childhood education and care services, and the community, as well as other broader factors in society. KidsMatter is made up of 4 interrelated components: creating a sense of community, developing children's social and emotional skills, working with parents and carers, and helping children experiencing mental health difficulties. KidsMatter Early Childhood also considers how relationships, the environment, policies, practices, events, and children's development and learning influence well-being. It involves all members of the early childhood education and care community: children, educators, families, and other community services, all working together to focus on mental health and well-being. You can implement the components sequentially, or you can start and focus on any of the components depending on your needs and context. And by now, some of you may be wondering, does KidsMatter actually make a difference? The evaluation of KidsMatter Early Childhood indicated a number of significant outcomes. Services that engage with KidsMatter achieve positive outcomes for children, families and educators. Educators developed a deeper understanding of mental health and felt more confident in supporting children with difficulties, and families reported that early childhood services were better able to meet their needs.
In working through the KidsMatter component, the reflective questions have really helped the team to talk about how they're working through things with families and how they're really relating to families and how they're communicating with children and each other. And it's also helped the educators to think about their every day-to-day practice, and it's helped them to be reflective about that day-to-day practice and think of how they fit in with that practice as well as the children and the families.
What we notice is once people have been involved in the KidsMatter Early Childhood Framework is that they actually are a lot more intentional about the decisions they make, and the decisions they make are often, there's that idea, okay, well, how is this going to influence the mental health and wellbeing of the children, but also the entire community?
I think one of the most noticeable things that I noticed in services was the way staff changed their view of children's behaviour and their diverse families, and how they worked in a different way with both families and children as a result of that. I think that was a really positive move as a result of KidsMatter.
When I was going and visiting early childhood services, I really noticed some positive changes, and they often started to occur between 9 and 18 months after services had started KidsMatter. And I would go and visit these services, and I'd sort of go in and think, something's changed. Have they painted the walls? What have they done? And really nothing had changed in the physical environment, but what had changed was the social and emotional environment. I would feel welcomed. Educators would make eye contact and welcome me. There was a sense of calmness in their service. You didn't hear children crying so much, if at all. Everyone seemed much more happy and content. And when I asked about, what had changed with KidsMatter, what educators reported was that in fact children were more settled. They were enjoying their work more. They were able to understand the causes of children's behaviour, and so they were able to really respond effectively and in a calm and supportive way. And also with some of those situations that really were very difficult, educators were able to really come to peace with some of those challenges that they had in the service and work with them in a calm and supportive way, because they had the mental health framework from which to support their thinking and their practice.